Medicare with a supplement is the only health insurance in America that does not have a network. Everything else you've ever had in your life or can have is network-based. Medicare with a supplement plan has no network. What does that mean? You can go to any doctor's office you like that accepts Medicare, and 99% of all doctors take Medicare. You only get the 6-month window leading up to your 65th birthday to get one without health questions. They're usually wanting to rule you out because it's the more comprehensive coverage. They're going to have to stroke more checks in your medical life if things come up. They're going to have to pay more. So they'd rather weed you out. But the government does have it rigged in your favor so that in the 6 months leading up to your 65th birthday and for 3 months after, they cannot ask you any health questions. Now, if you decide to go the next route we're going to look at later, which is cheaper, but decide you don't like the way it works coverage-wise as much and you want to come back to this route, fine. But you will have to health qualify at that time. You can go to any hospital you like. Mayo Clinic, yes. All these other finer institutions, absolutely. Will Mayo Clinic take the next route we look at called Advantage Plan? No. So that's why it's important. Understand there's differences in these two routes. A main one is network. No network at all with Medicare and a supplement by any carrier. A supplement by United Healthcare, a supplement by Aetna, a supplement by anybody. No network, okay? How does this one work? You're gonna pay a carrier a monthly payment. How much are you gonna pay them? In South Georgia, it's different than in Chicago, Illinois, or in Jacksonville, Florida. But around here, in South Georgia, a female turning 65 is gonna pay about $85 to $90 a month for a supplement, and a man is gonna pay $10 a month more, $95 to $100. They're gonna draft it out of your checking account if you get one of these. What are you getting in exchange for that? For your supplement plan and you're paying them this $85 to $100 a month, if you go into the hospital, any hospital, because there's no network, you don't pay anything. So all those costs we talked about under A, they absorb them all. So it doesn't matter how long you're there, up to 365 days, and it doesn't matter what they do to you there. It's covered at 100% inside the hospital with a supplement plan. It doesn't get any more straightforward than that. You go in the hospital, you're covered at 100%. Clear? Outside the hospital. Outside the hospital. You deduct the first $257 of the year. That's your deductible in your medical life. Once you have satisfied that $257 among all doctors, not at each office, but total, any additional doctor office after that, of any kind, anywhere, will be $20 for your copay. That's the framework. 0 at the hospital. Anywhere else, you pay the first $257 and then $20. Outpatient surgery is treated like a doctor office visit. So if you've met your $257, your outpatient surgery is going to cost $20. There is a different version of this one where you don't pay the $20, but instead it costs $35 a month more. That one only really makes the sense for people who are going to the doctors a lot or think they might be one day. Because most people don't want to pay $35 a month more just to dodge $20 copays occasionally. But some people I get do. Some people I get do. Depends on your situation. Drug coverage, nor dental, vision, or hearing are included on this route. So this is the route that is most comprehensive medically, but it doesn't include any trinkets, as I call them. Everything else that you want is added a la carte. D for drugs is going to be added separately. However, as I mentioned earlier, the add-on drug plans start at $0 a month. Average I deal with for people who add on a standalone drug plan is somewhere between 0 and the 21.
What determines the increase?